Okay, let's talk about the skin you're in. Your skin is your first line of defense against lots of organisms wreaking havoc in your body, from infections and viruses to rashes. It's one of the most important parts of your immune system because it's a protective barrier. It's kind of like the Coast Guard, right? It keeps bad things out of your body. But your skin can also react to lots of things in the environment. And you may have noticed this if you have friends come over and they have pets, dogs or cats, and they have dander on their clothes, and all of a sudden you feel a little bit itchy. Or if you're outside and you rub up against a plant and all of a sudden you've got poison oak or poison ivy. There's a lot of things that can irritate your skin. And luckily, I have learned a lot from my dermatology book. This is the Color Atlas and Synopsis of Clinical Dermatology. And as a nurse practitioner, we have to learn a lot about how to recognize different forms of skin cancer, but also how to treat some of the most common issues that come up with people's skin. Whenever I'm not sure what to do, I refer my patients to a dermatologist so that they can take a biopsy and use appropriate treatment. But I've learned a lot of things along the way, and let me share a few things with you today. So you may have noticed that occasionally you get a rash or a little bit of redness in the same part of your body, and it comes and it goes. It recurs every once in a while. This can be something called atopic dermatitis or eczema. What happens is that there are different parts of our skin that are more susceptible to irritation or to an irritant from the outside world, from the environment. And we can start to have some itching or redness. I get it right here between my middle finger and my ring finger anytime I peel potatoes. It's kind of weird, right? There must be something in the dirt or in some of the preservatives or the pesticides that they use, because I always get it in the same area. And it gets really itchy and scratchy and the skin gets really dry. So that's kind of the area that's always affected for me. Other people get eczema on their elbows, behind their knees, and in other parts of their bodies, and it always recurs in the same spot, even if that part of their skin doesn't get exposed to an irritant. They may be eating something and then they'll feel like a scratchiness in the back of their throat, and then they'll develop some redness around their elbows or on their forearms. So if you get a recurrent rash, kind of always in the same place, it's not so severe that you can't function, but it can keep you up at night from itching, there's a few things that you can do. First of all, you can wash the area with cool water. Don't use hot water, because hot water brings more blood flow to the area and it can actually make the symptoms much worse. So use cool water. You might also think about using Aveeno. Aveeno is a colloidal oatmeal and it's very soothing for the skin. Some people can't even tolerate that and they have to use a non-detergent cleanser like CeraVe or Cetaphil. And I want to reassure you, I don't work for any of these companies, but as a healthcare provider, I'm always recommending these mild cleansers and moisturizers to my patients. And I didn't want to embargo the information either. So using a mild cleanser to clean the skin with cool water often helps. If your skin is really, really irritated, use an ice pack, but be sure to use something on your skin like a paper towel or a very thin pillowcase before you put the ice pack on. Otherwise, the ice can actually burn the skin. To keep your skin moist, especially in the winter time when it's really dry, if you've got the heater on, I like to use this. I like to use Aquaphor. Aquaphor is basically petroleum jelly, so you can use Vaseline instead. It's an emollient. That means that it really traps the moisture inside the skin. And I don't know about you, but I get these little cracks in my skin and it takes about a week for them to heal, and I have to be constantly reapplying Vaseline or Aquaphor to the area. So that's one way to keep the skin moist, is to trap in moisture. If you're going to trap in moisture, you better have some moisture in your body, and that means drinking lots and lots of liquids or having juicy fruit throughout the day. Not fruit juice, because that spikes your blood sugar, but having things like apples and tangerines, oranges, That will really help you boost up the amount of hydration you have in your body to keep it in your skin. If you have an irritation that's really itching and really bothering you, you can stop the itch, you can stop the symptom with Benadryl. So Benadryl is diphenhydramine. All right, you don't have to pronounce that, but you can take Benadryl and it will only treat the symptom. It will not cure the problem. So a little bit of Benadryl applied to your skin can help reduce the itching. Now, if you apply too much of it, it gets absorbed throughout your whole body and it can make you sleepy. It can also make you feel like you have a dry mouth. Some people take an oral Benadryl tablet. That also stops the itching if it's all over your body. But again, that can make your mouth really, really dry and it can make you very sleepy. So be very careful when you use Benadryl. The other thing you might try is cortisone. So cortisone is an anti-inflammatory, and I always carry cortisone with me in my purse whenever I travel because you never know what's going to irritate your skin. So cortisone, and this is over the counter, you don't need a prescription. I always get the 1%, and when you put this on, it decreases the inflammation just in that area. And that will help stop the body's natural inflammatory response that's causing the itching and the irritation. So if you're having something that recurs over and over again, and it's always in the same spot, and it's bothering you or it's interfering with your life, talk to your healthcare provider or see a dermatologist. You may need a stronger prescription strength topical treatment or a topical steroid cream. If you have a recurrent irritation in your genitals, make sure you talk to your healthcare provider, have them evaluate it, and make sure you know exactly what it is before you put anything on it to treat it yourself. There are many things that mimic or act like eczema, and you want to make sure you get the right treatment for it. Otherwise, it can progress, it can get a lot worse and cause a lot of distress and a lot of pain. So if you have any questions, pop them below in the comment section. I hope you'll click like and subscribe and let me know what other topics you'd like me to cover. Take care, be well, and make sure you're using lots of moisturizer on your skin.